Arixtra Injection is a widely used medication for preventing blood clots, offering numerous benefits for patients. Whether you have undergone surgery, are bedridden, or have a medical condition that increases your risk of blood clot formation, Arixtra can be an effective solution to reduce the chances of this potentially dangerous occurrence. What is Arixtra Injection? Arixtra Injection is a medication that belongs to a class of drugs known as anticoagulants. It contains the active ingredient fondaparinux sodium, which works by inhibiting the formation of blood clots in the veins of your legs, lungs, or after certain types of surgery. This medication is available in pre-filled syringes, making it easy to administer either by yourself or with the help of a healthcare professional. How does Arixtra Injection work? Arixtra Injection works by targeting a specific clotting factor in the blood known as factor XA. By inhibiting the action of factor XA, Arixtra prevents the formation of blood clots. This is particularly important for individuals who are at an increased risk of developing blood clots, as these clots can lead to serious conditions such as deep vein thrombosis, DVT, or pulmonary embolism, PE. When Arixtra is injected, it enters the bloodstream and binds to a molecule called antithrombin 3. This complex then inhibits the activity of factor XA, which is necessary for the formation of blood clots. By interrupting this process, Arixtra effectively reduces the risk of blood clot formation and its associated complications. Common uses of Arixtra Injection. Arixtra Injection is commonly used in various clinical scenarios to prevent blood clot formation. Some of the common uses of Arixtra include post-surgical prevention. After certain types of surgeries, such as orthopedic procedures, e.g., hip or knee replacement, there is an increased risk of blood clot formation. Arixtra Injection is often prescribed in these cases to prevent the formation of blood clots in the deep veins of the legs, known as deep vein thrombosis, DVT. Medical conditions. Certain medical conditions, such as acute medical illness or cancer, can increase the risk of blood clot formation. Arixtra is sometimes used in these situations to reduce the likelihood of developing blood clots. Extended bed rest. Prolonged bed rest, such as during hospitalization or due to a medical condition, can lead to blood clot formation. Arixtra Injection may be prescribed to individuals who are bedridden for extended periods to minimize the risk of DVT or PE. Outpatient prophylaxis. In some cases, individuals may require blood clot prevention while at home. Arixtra Injection can be self-administered by these patients, following proper training and instructions provided by their healthcare provider. These are just a few examples of the common uses of Arixtra Injection. It is important to note that Arixtra should always be used under the guidance and prescription of a healthcare professional. Benefits of using Arixtra Injection. The use of Arixtra Injection for blood clot prevention offers several benefits for patients. Some of the key advantages of using Arixtra include efficacy. Arixtra has been proven to be effective in preventing blood clots, reducing the risk of serious complications such as DVT and PE. Clinical studies have demonstrated its ability to significantly lower the incidence of blood clot formation in various patient populations. Ease of administration. Arixtra Injection is available in pre-filled syringes, making it easy to administer. This allows for convenient self-administration at home or can be administered by a healthcare professional in a clinical setting. The simplicity of the injection process makes it accessible and manageable for patients. Predictable dosing. Arixtra has a predictable dosing schedule, ensuring consistency and reliability in its administration. This allows healthcare professionals to accurately prescribe and monitor the medication, ensuring patients receive the appropriate dosage for their specific needs. Safety profile. Arixtra has a well-established safety profile, with extensive research and clinical experience supporting its use. While all medications carry some risk of side effects, Arixtra has been shown to have a favorable risk-benefit profile when used appropriately. These benefits make Arixtra an attractive option for individuals who require blood clot prevention. However, it is important to discuss your specific medical history and needs with your healthcare provider to determine if Arixtra is the right choice for you. Arixtra Injection dosage and administration. The dosage and administration of Arixtra Injection may vary depending on the individual's specific needs and medical condition. It is important to follow the instructions provided by your healthcare provider and adhere to the prescribed dosage. Arixtra Injection is typically given once daily and is administered subcutaneously, under the skin. The injection site is usually the lower abdomen, about 2 inches away from the belly button. Your healthcare provider will guide you on the proper injection technique and provide detailed instructions to ensure accurate and safe administration. The dosage of Arixtra is determined based on factors such as body weight, renal function, and the specific indication for which it is being prescribed. Your healthcare provider will calculate the appropriate dosage for you and provide clear instructions on how to administer the medication. It is important to remember that Arixtra should not be discontinued or the dosage altered without consulting your healthcare provider. Abruptly stopping or changing the dosage of Arixtra can increase the risk of blood clot formation or other complications. Potential side effects of Arixtra injection. While Arixtra injection is generally well tolerated, like any medication, it can cause side effects. It is important to be aware of these potential side effects and discuss them with your healthcare provider. Some of the common side effects associated with Arixtra include bleeding. Arixtra is an anticoagulant medication, which means it can increase the risk of bleeding. This can manifest as easy bruising, nosebleeds, or prolonged bleeding from minor cuts or injuries. In rare cases, Arixtra can cause serious bleeding, such as gastrointestinal bleeding or intracranial hemorrhage. If you experience any signs of bleeding, it is important to seek medical attention immediately. Injection site reactions. Some individuals may experience mild irritation or redness at the injection site. This is usually temporary and resolves on its own. If you develop severe pain, swelling, or signs of infection at the injection site, contact your healthcare provider. Hypersensitivity reactions. In rare cases, Arixtra can cause allergic or hypersensitivity reactions. Symptoms may include rash, itching, swelling, or difficulty breathing. If you experience any of these symptoms, seek immediate medical attention. It is important to note that this is not an exhaustive list of side effects. If you have any concerns or experience any unusual symptoms while taking Arixtra, it is important to contact your healthcare provider for further evaluation and guidance. Precautions and contraindications for using Arixtra injection. While Arixtra can be beneficial for many individuals, there are certain precautions and contraindications that should be considered. It is important to discuss your medical history and any underlying conditions with your healthcare provider before starting Arixtra. Some of the precautions and contraindications for using Arixtra include bleeding disorders. Arixtra is an anticoagulant medication and can increase the risk of bleeding. Individuals with bleeding disorders or a history of bleeding should use Arixtra with caution. Severe renal impairment. Arixtra is primarily eliminated from the body through the kidneys. Individuals with severe renal impairment may require dose adjustments or alternative medications. Hypersensitivity. If you have a known hypersensitivity or allergic reaction to Arixtra or any of its components, it is important to avoid using this medication. Pregnancy and breastfeeding. The use of Arixtra during pregnancy or breastfeeding should be discussed with your healthcare provider. The potential risks and benefits should be carefully evaluated before starting or continuing Arixtra in these situations. These are just a few examples of the precautions and contraindications associated with Arixtra. It is important to have a thorough discussion with your healthcare provider to ensure the safe and appropriate use of this medication. Frequently asked questions about Arixtra injection. Can I self-administer Arixtra injection at home? Yes, Arixtra injection can be self-administered at home, following proper training and instructions from your healthcare provider. It is important to strictly adhere to the prescribed dosage and administration technique. How long do I need to take Arixtra after surgery? The duration of Arixtra treatment after surgery can vary depending on the specific procedure and individual factors. Your healthcare provider will determine the appropriate duration of treatment based on your risk factors and medical condition. Can Arixtra be used in children? Arixtra is not typically used in children. The safety and efficacy of Arixtra in pediatric populations have not been extensively studied. Can I take other medications while using Arixtra? It is important to inform your healthcare provider about all the medications you are taking, including over-the-counter drugs, supplements, and herbal remedies. Some medications can interact with Arixtra, potentially affecting its effectiveness or increasing the risk of bleeding. These are just a few frequently asked questions about Arixtra. It is important to consult with your healthcare provider for personalized information and guidance based on your specific circumstances. Alternatives to Arixtra injection for blood clot prevention. While Arixtra is an effective medication for blood clot prevention, there are alternative medications available. Your healthcare provider will determine the most appropriate option based on your specific needs and medical condition. Some alternative medications for blood clot prevention include heparin. Heparin is an anticoagulant medication that can be given intravenously or subcutaneously. It is commonly used for blood clot prevention in various clinical scenarios. Warfarin. Warfarin is an oral anticoagulant that is often prescribed for long-term blood clot prevention. It requires regular monitoring of blood clotting factors and dosage adjustments. Direct oral anticoagulants, DOACs. DOACs, such as rivaroxaban or apixaban, are oral medications that directly inhibit specific clotting factors. They are commonly used for blood clot prevention and have advantages such as fixed dosing and fewer drug interactions compared to warfarin. The choice of medication will depend on factors such as the specific indication, patient preferences, and potential interactions with other medications. Your healthcare provider will guide you in selecting the most appropriate alternative if Arixtra is not suitable for you. Conclusion: Arixtra Injection is a valuable medication for preventing blood clots in individuals at risk. Its anticoagulant properties and ease of administration make it an attractive option for various clinical scenarios, including post-surgical prevention, medical conditions, and extended bed rest. With its proven efficacy and safety profile, Arixtra provides peace of mind for individuals who require blood clot prevention. It is important to consult with your healthcare provider to determine if Arixtra is the right choice for you. Your healthcare provider will assess your specific needs, medical history, and potential contraindications to ensure the safe and effective use of Arixtra. By taking proactive steps to prevent blood clots, you are prioritizing your health and reducing the risk of serious complications associated with blood clot formation.